My name is Belinda Danielson. I'm with the Adult Mental Health Division, Department of Health, representing also my sister division, our sister division, the Alcohol and Drug Abuse Division. So just giving you folks a little background on Hawai'i Cares because I've limited myself to 2 minutes, so please help me along with that. In 2019, the Alcohol and Drug Abuse Division decided to put out a call for a service for substance use in regards to a one-stop shop kind of a thing and for utilization management. So that started in 2019. And then along in 2020, there was a decision by our division, by our administration, to kind of have a one-stop shop for behavioral health in general. So that included mental health, behavioral health, crisis. Those have come together. So that was the birth of Hawai'i Cares as we know it now. One-stop shop for behavioral health, substance use, behavioral health, mental health, and of course, most importantly is the crisis and suicide. So you have one number to call to reach all of those services. So represented here today, of course, is our crisis and suicide with mental health, and of course, our substance use disorder program as well. So with that, I don't think I have much more to say, but we're just very happy to be here to share about Hawai'i Cares. And the only other thing that I would add to that is we have our numbers for Hawai'i Cares that have been around for many of you who might be a little unseasoned, as I am. The local numbers, the 808-832-3100, or the 1-800-753-6879 for our neighbor islands. As of July 16th of this year, there was a national conversion or transition to a simpler number that's elevated mental health and substance use and crisis to a whole different level. And we are happy to say that Hawai'i Cares is part of that transition, and that's our 988 number. So just so everyone understands that 988 is another way to get to Hawai'i Cares besides our local numbers, the 808-832-3100 and our 1-800-753-6879. So these folks are going to talk all about it. So without further ado, I'm just going to introduce the crisis side of the house, and they will go ahead and introduce the substance use disorder side of the house when they are done. So I have here Brian Morton, who is the president of Hawai'i Care Hawaii. Also have Sherrie Freitas, who is the executive director of behavioral health for Care Hawaii. And we also have Ms. Sasha Farmer, who is one of the shift leads for the Hawai'i Cares line as well. So with that, I'm going to hand it over to Ms. Sherrie Freitas. Thank you.
So I'm going to apologize in advance for the last speakers of the day. So I know that everybody's probably kind of tired. So bear with me. I'm going to try hard to make it as not boring as possible. So when you hear the word Hawai'i Cares, what do you guys think of? What do you hear? What do you think of? Crisis line. Thank you. What else do you think of? The beach? The beach. I like that. What else do you think of? Anything else? Coordinated access. Great responses. So anything else? Help for the homeless. Great. So today what I wanted to do was provide some information about what we are, because a lot of times people hear about our services and some people just think that we are just a hotline. Some people still think that we are just kind of like operators behind a desk. And I wanted to make sure that everybody knows that Hawai'i Cares is more than just telephone operators. We are the linkage. We are resources and referrals. We are suicide. We are crisis counselors. And we are here to help people statewide. So wanted to explain to you guys, when you see our logo, the logo for Hawai'i Cares is the tree. And the tree is not just your ordinary tree. It's a tree of love. It's a tree with hands that are supposed to be impacting the community. It's a tree of hands that's meant to be helping the community. We are statewide services, as I mentioned. We are dedicated. We are local. So when you're calling Hawai'i Cares, even though we are going to be describing 988, we are in Hawaii. We are locally bound. We have staff that represent the diverse cultures. We believe in Ohana values. We are a partnership with Department of Health, the community mental health agencies, substance abuse agencies statewide. We provide evidence-based services, and we try very hard to make sure that our staff is trained up. So every week, twice a week, we are trying hard to make sure our staff receives the best training possible, because we want our staff to know what is out there. And we're trying to make sure that we're hearing about all the different call centers nationwide to make sure that we're providing this community the best possible service, because we believe in what we do and we care. So the name CARES is not just something that we just throw around. We care. It's something that we're committed to. And that's why we're having these words. We're committed to the community. We're local roots, local driven, and we strive for excellence. So throughout the presentation, you're going to hear about the different service array, and you're going to be hearing about some of the things that we're able to dispatch. So once again, we are a partnership, like I mentioned, with Hawaii Department of Health, community-based mental health agencies, and the substance abuse providers statewide. And that's why our next partner that's going to be presenting is Aloha United Way, because we make sure that when you call Hawaii Cares, we're trying to make sure that everything as seamless as possible, that there's going to be a smooth transition between making sure that your crisis needs, your needs to address if you're at risk for suicide is being handled as seamless as possible. Our behavioral health and crisis, we have a behavioral health crisis and suicide call center that's open 24 hours per day. So this is something that's a bit new. Before, people would just think that we are just a hotline. Now I want to make sure with 988, we are making sure that we're attending to suicidality up front. So if a caller calls our call center, we are asking up front, are you in a crisis or are you suicidal? Because we don't want to take that risk, and we want to make sure that every person is asked that question. If they say no, we move on respectfully. And if they are, we go ahead and we make sure that we ask those risk assessment questions and such, because we want to make sure that every person is able to have those screening questions, because we take that seriously. Our crisis counselors specialize in providing supportive counseling, screening for urgent, emergent mental health or substance needs, which means that we do our screenings based on risk levels first. So that's kind of when we're saying urgent and emergent, that's kind of a fancy way for the way that we classify the type of calls that we have. Urgent is if we're needing to do a dispatch for CMO. Emergent is if there's a need that we're needing to escalate the call to 911 or other kind of immediate resources. So that's kind of the different ways in which we classify it, always based on making sure that safety is being attended first. And once again, we make sure that we do the recommendations for behavioral health assessments and for substance abuse services and crisis interventions. Okay. Our crisis counselors provide non-judgmental services with compassion delivered with the spirit of aloha. So that's super important for us, is we're locally based. Everything has to be treated with aloha. We mentioned about the linkages and referrals. So that's something that we're going to explain a little bit further again in our presentations. And we talked about our trainings already. So that's something that we take very seriously, because we want to make sure that our staff maintains great skill set. Data. So you might be wanting to know about data. So when you look at this graph, it may seem a bit confusing. So I'll go ahead and explain it. The numbers at the top, those are it's just a snapshot of what our daily call averages are. So you may see in that graph, you may see an average daily call volume from 400, 500, down to some days that are 194. Just kind of briefly summarize it. The peak calls are usually on Monday, Tuesday, Wednesday. The lowest call volumes are usually on the weekends. It seems to be kind of a trend that usually happens over periods of times. At the very top, it talks about the total length of calls in minutes. So that's the top number. And at the very, very top, that number was for the month of August. So for the month of August, we had 10,942 calls. So that was the volume of calls that we received at our call center. So, I mean, if you ever wonder, is our staff working? Yes, they're answering a lot of calls. So if there's any time in which you called and there's they're not able to answer right away, they're trying their hardest to answer. I'm trying very hard to fill the chairs. Like on a day, I have at least like 10 to 12 crisis counselors every day. So they're trying their hardest. So that's the volume that we're having. So they're working. Average speed to answer a call, about 18 seconds to answer a call. So, I'm very proud of my staff. I think they're doing a good job to make sure that they're answering the calls as fast as they come in. Question?
Yeah, is there an ability for texting?
Yes. Great question. And that's going to be part of the presentation. So yes, I'm going to be explaining that, and we're super excited about that. Take it away, Sasha.
Aloha, everyone. I'm Sasha. So to contact Hawai'i Cares, we have 3 ways to contact Hawai'i Cares. Like what Belinda had mentioned earlier, it's the number that is the standard number that everybody has been acclimated to, which is the 808-832-3100. We also have our toll-free number for the neighbor islands. And I'm proud to announce that we had launched 98 July 16th. So 98 is one of those numbers that is easy to remember. We have 911, right, for medical, police, or fire. So think of us as your mental health, substance abuse crisis dispatchers. This is where you get to call. 988 is a friendly user, easy to remember for people who are in crisis. When you're in crisis, it's hard to remember a 10-digit number. Yeah, so 98 has been simplified for individuals who are suffering from any mental health crises, suicide, or even substance abuse. So that's 988, and this is how you can contact Hawai'i Cares. Here you see pictures of how Sherrie had coordinated our office to be a facility where we service with Aloha. Sherrie had put it upon the team that we have yoga balls. It's a great way to relax. It's a great way for the team to come together. I'll let Sherrie talk more about the services with Aloha for our agency.
So one of the things that, oops, I want to make sure. One of the things that's different is that Care Hawai'i actually took over the call center in April 1st. And one of the things that we had to think about was what was going to be our staff? What was going to be the way that we wanted the feel for the call center? How did we want the staff to feel when they walk in the door? And one of the things that was important to me was making sure that the staff that walked in the door felt like that they had a safe place. When they're answering call after call after call, they're answering calls that, it's endless crisis. And I wanted them to feel safe in the door. So we thought about different ways that we could use comfortable paint colors and having yoga balls and just creating a center that was therapeutic, creating a center in which they would feel a sense of ohana. So we do lots of celebrations. We do, like, there's birthday parties on the Y, there's potlucks on the Y. I did not want our call center to have any kind of cubicles because I didn't want us to feel as though they're ever isolated. Calls are handled as a team. If there's any times in which they have questions or need support, they can flag, they can go ahead and ask for help. We really make sure that they have the support and they have a sense of ohana. So that was something that was super important to us. So we believe in trauma-informed care. We believe in making sure that there's cultural competency. We believe in making sure that they got the support through the trainings, got the support through just operating kind of as one big ohana. So that's kind of why we took the pictures like that. And these are actual pictures of our staff. So yeah, it's just local roots, diversity, and just making sure that we're representing the people that live here, because we want the callers to feel as though they're understood. So it's just what we believe in. Next. Is that backwards or forward? Forward.
Okay, as mentioned, as 98, we had launched it July 16th. And I had also mentioned it's an easy 3-digit number to remember. Like I said, for people who are in crisis or in need of crisis, it's hard to remember a 10-digit number. So thank God that they simplified how we can access services. Yeah. NSPL has been around since 2005, just to let you folks know. 98 is a confidential and free service for everyone out in the community. One of the things that I want to also remind you folks and inform you folks is that 98 and also Hawai'i Cares do provide services to adults and adolescents statewide. Connecting those experiences with mental health, substance abuse, again, with suicidal crisis, with our trained counselor. In the previous slide, you've seen a picture in the middle, the man that was in the middle. I just want to say he's been an employee of the crisis line for 20 years. So if you talk about cultural competency and experiences, he is one of those employees or staff members that brings his experience, and he's able to train us and guide us on how to deal with crises. So I just want to let you folks know that we have seasoned employees. Next slide, please. Again, 98, like I said, I can't drive it enough how 98 has been simplified. One of the things that I want to emphasize is people who reside in Hawaii who have an outside area code. Let's just say you live in Hawaii and you have an Oregon area code. If you are in crisis and you do call 988, you will be routed to Oregon. But mind, all you have to do is say that I'm a resident of Hawaii, and you will be rerouted back to the Hawaii 98 crisis line. One of the advantages of having 988 is that we've created a system where we do a 24-hour follow-up. Let's just say a consumer calls and they're in crisis, but they refuse crisis services, meaning a crisis mobile outreach worker. We have a system where we put it into a chat where every staff is able to see, and we're able to follow up within that 24 hours. One of the things that we want to do is make sure that these people who call that is in crisis, we want to follow up and make sure that they are linked up with services at any given time, because sometimes callers, they may call in the beginning and they may not want a crisis worker, but through therapeutic support and therapeutic counseling, and a 24-hour follow-up, maybe we can engage with the client and have them change their mind. And that is the benefit of having 98 and having Hawai'i Cares.
Text chat. So this is something that we're super excited about, because with texting and chatting, we're able to reach a whole other generation. We understand that the young generation, that's their normal way of communication. If you look at any teenager, what are they doing most of the day? So we know that we want to make sure that getting help, we're able to reach them, right? We don't want them to feel as though it's just something that they don't want to do. Like if you're asking like a 14-year-old, 15-year-old, a lot of times they're not going to want to pick up the phone to ask for help, but texting, chatting, that's what they do. So we wanted to make sure that we're staying up with the times, that we're being innovative, that we're making sure that we're doing what's best practice, what the nation is asking, and what we know is best for the community. So as of September 1st, our call center started it. And we're starting it by making sure that we're being successful. So we didn't want to take on too much too soon. So the national call, the NSPL Lifeline is the crisis lifeline services that actually provides it 24 hours a day. So even though right now our services for text chat is only available from 2 o'clock to 8 o'clock, if you wanted to do a text or a chat, that service is still available 24 hours a day. So there's two ways that a person can text or chat to receive services. The first way is to actually on a phone or a tablet or something, they could actually text 988. The second way is to actually go to the NSPL Lifeline, and you can see the link right there, and you would actually go to that site and you would actually log on, and there's a prompt that would take you through a pre-chat survey, and you could actually chat on it. There's a question. I want to make sure I'm responding to the chats. Let me find with the chats. What is the time frame for a caller to get mental health counselor? If that question is related to texting, it would be immediately. So if they actually texted us, they would actually get a text back right away. So the other cool thing for the text chat is this is some way that we're able to help the hearing impaired. So the cool thing about the text chat too is it's a new way for our crisis counselors to have to stay innovative too, because our crisis counselors are having to learn to like sometimes use an urban dictionary. They're having to learn about the different emojis, and internally we're having to talk stories with each other about like, what does this mean? Like, what is the word drip? I thought it was swag. That's not the word this week. It's drip. And like, it's interesting because we're having to learn and talk to each other's kids. But you know, that's what it is. Like the world is about learning, and it gives us a chance to learn and grow. So it's exciting times to be part of this call center because it's constantly changing. So it's great growth opportunities for us to be able to tackle this challenge. So we're grateful.
Now the fun stuff to discuss Hawaii Care's workflow. So all our crisis counselors are providing, when they answer the phone, they have a standard screening. And the standard screening is, are you feeling suicidal or in a crisis? That gives us, or the counselors, a way to determine and navigate through the system as far as what services are provided and what is needed. Next slide. So if the caller says that they're suicidal, this is where the crisis screener, sorry, we just moved and changed the title of our screeners. It's no longer screeners, it's counselors. So I'm trying to get acclimated to it, so please forgive me. Anyway, so our counselors, our crisis counselors are required to determine and assess further the imminent danger. So if the imminent danger is where the consumer is not agreeable to safety planning, this is where we talk about and try to coordinate with 911. And mind you, our counselors are not handling the situation on their own. This is where we have, this is what we call Ohana building. This is where we pull together as teammates, and the primary counselor remains on the phone with the client, remain engaged while the other counselors are trying to dispatch 911 and also collaborate services with existing case managers if there is one. But just know that the client is being referred, or even 911 is being dispatched for their safety. Next slide, please. Another thing on the, if they are suicidal and they're able to be agreeable to safety planning, one of the things that we do is we dispatch for a crisis worker, which is a CMO, crisis mobile outreach. This is where they have they have 45 minutes to an hour to show up. This is a face-to-face with the consumer. They do extensive assessment to determine what services are needed, what level of care. If the consumer, let's just say we have doctors in here and we have treatment providers, let's just say, or even case managers that's in this audience. Let's just say you have a consumer who is homeless and they are stressed, they're having anxiety, they're depressed. Having had to go through the pandemic, there's been a lot of crises that has come about. So let's just say they don't have services and they're depressed, like I had mentioned. This is a perfect opportunity and service that they can utilize to link up with temporary case management, whether it's a crisis shelter, stabilization bed, long-term case management. This is a program which is beneficial for consumers because it's a worker that is meeting with them face to face. A lot of our consumers, they don't know how to read or write. A lot of our consumers experience a lot of anxiety, depression, just having challenges navigate through the system. So this is a perfect service that would assist the consumers, say if you will, walking with them hand by hand, hand in hand, or walking alongside of them. If they are not in suicidal crisis, go ahead. One of the things that we do is we screen if they have substance abuse issues. And this is where we have the partnership with Aloha United Way. If they have just substance abuse issues, we do a warm handoff to Aloha United Way, and we don't disconnect right away. What we do is we gather the information from the consumers, their name, their phone number, and also the needs of the substance abuse. And when we do the warm handoff, we let them know who we are, what the client's name is, their contact number, and what they're calling for. Once that is done, then we get off the line. So then that way, Aloha United Way is able to do their thing. Another thing that we do screen for substance abuse is to see if they've called before, if they've been in the WIT system. And that is a message that we do pass on to Aloha United Way. Next slide, please. For mental health over here, this is where we, like I had mentioned, this is where the crisis worker can go out. Perfect opportunity. Again, I can't emphasize enough. This is a service that is beneficial for consumers. Oftentimes, a lot of consumers, let's just say we have, I'll use my ethnic background. We have Filipinos that call. They see people or their loved ones going through a real difficult time. Fortunately, I speak the language, so I'm able to navigate through the system and assist these callers, Filipino elderly people who are struggling with family members. They don't know where to turn. They don't know what services to, and this is where I get to give back to my ethnic background, and I get to translate and I get to explain what the services are. And at the very end, a couple of days later or a week later, they end up calling and saying thank you. So these are one of the things. One of the things I also want to emphasize too and let you folks know is that even if you have a consumer out there who does not speak English, one of the things that we do is we connect them to the interpreting line. So no one gets left behind is what I say. And over here, this is where we get phone calls from jail diversion, probation officers, judiciary. This is where we get to link up our consumers with services as well.
So when I mentioned that we're more than just a call center, we do community outreaches also. So if there's ever a need for us to come out to do a mental health fair, a community fair, or a presentation in service, let us know. We can do it in person, or with the nature of the times, we can do it virtually. Just go ahead and let us know, and we would want to support you in the community. So these are just a couple of pictures of some of the in-services that we've done. Thank you. So I mentioned that we're going to be able to explain some of the services that we're able to dispatch. So one of the first services that we're able to dispatch for is the CMO. CMO stands for Crisis Mobile Outreach Services. So one of the things that I wanted to mention is a lot of times people think that you have to be suicidal to get a CMO. Please know that you don't have to be suicidal to get a CMO. You can get a crisis mobile outreach based on being in a crisis. And a crisis can vary. Everybody's crisis is based on their perception. It could be that you're dealing with a breakup, you could be going through an eviction, you could be going through grief, you could be going through a mental health crisis. Your crisis is your individual situation, and you can call Hawai'i Cares and they can send someone out to see you. So I want you to understand that it's not just people that are suicidal. Unfortunately, that has gotten around, and they want to make sure that that information was clarified. So what does the CMO do? The CMO is able to do risk assessments. The CMO is able to help with linkages and referrals. The CMO is able to find out if the consumer has case management services. And if the client does not have case management services, they can refer them to something called the CSM. And Sasha is going to be explaining about that service. But the CMO service is something that is free. It's 24 hours a day and they come to you. So it's something that is non-judgmental. It's something that is meant to support. It doesn't matter what your insurance is. It doesn't matter if you have case management. It's just there to support you.
Okay, again, emphasizing on CSM, crisis support management. Crisis support management is a 30-day program. Consumers who have or who are linked to case management services are not able to qualify for CSM services. CSM services is also not for adolescents or for the youth. For the youth and adolescents, we have a 30-day follow-up. For CSM, it's for adults who are not linked for services. This is a great way, like I had mentioned earlier, where a temporary case manager can link the consumers to long-term case management. This is a great opportunity for consumers to be linked to a therapist, a psychiatrist, a psychologist. Like I had mentioned earlier, some consumers are not able to read and write or navigate through the system. CSM is a program or an individual that is able to follow the client for 30 days and assist them with filling out the MedQuest or food stamp application. Let alone, this is where long-term case management is being referred for housing and other services that is needed. So CSM is also 24 hours, available 24 hours, 7 days a week, 365 days. And with CSM, if the consumer had CSM within that 30 days, there is a 30-day waiting period after that before they get qualified again for another 30 days.
So great question. That was one of the things that I wanted to expand on, was that when I was presenting on CMO, I forgot to mention that there are CMO services statewide for adult and keiki. So on the island of Hawaii, CFS is the agency that's assigned to provide youth CMO services, and there is another agency that is Care Hawaii to provide the adult CMO services. So on every island and every part of the state, there are CMO services for adults and for keiki. So what happens is for dispatching, everybody calls into Hawai'i Cares, and we dispatch for all islands for all programs. So regardless of who the provider is, regardless if it's a youth or an adult, Hawai'i Cares does the dispatching. Thank you. So moving on to Licensed Crisis Residential Shelter, otherwise known as LCRS. So there's 3 LCRSs within the state of Hawaii. So one LCRS is on Hawaii Island on the Hilo side. The other is on Maui, and one is on the island of Oahu right here. And the LCRS is a place in which consumers can go to provide psychiatric stabilization. And it's a place in which they can go to help with recovery. One of the benefits of the LCRS is that at the LCRS, they have an RN that's there 24/7. And the RN is there to dispense the medication. So say you have a consumer that's restarting medication or is starting new medication. One of the things that's wonderful about the LCRS is that the RN can actually dispense the medication. and they can actually work with the client, work with the provider, work with the case manager, and together you can actually have some feedback about the medication efficacy, right? So you can kind of monitor the symptoms and see if there has been a symptom reduction and to provide some feedback. So you get some time of adjusting to this new medication while in a safe and stable place to kind of see if it's working. So that's, one of the benefits of going to the LCRS. Well, at the LCRS, they can be provided with some coping skills and supported with learning how to manage their stressors. It's also a place in which the case manager can help them with doing their applications for other treatment programs and such. But it is not a place in which it is ever intended to be long-term. Sometimes when we get referrals to LCRS, sometimes people believe that it's like, oh, that's placement, they're going to live there. No, 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 no. It's meant to be a place in which they're there to stabilize for a short period of time and then to move on. Next. Certified peer specialist. So this is another benefit of our services. So the certified peer specialist is a person that's there to support. It's a peer that's able to help them with motivating them and helping them to get support. Next.
Okay, bear with me. I have 1 minute to just to inform you folks of the stabilization bed. Stabilization bed is a lower level of care, which does not qualify the consumer to the emergency room or being admitted to the emergency room. It's a lower level of care from LCRS, and what deciphers or what is different about the stabilization bed is that you don't have an RN on staff. So clients should be able to administer their own medication. They should be ambulatory because we have 3 stabilization beds. One is Ikolu, which is in Kaneohe, Waikiki Beachside, which is in Honolulu, and Waikiki Beachside is, they have 4 flights of stairs, and Ikolu is gravel, so they should be ambulatory. So stabilization bed also provides wraparound services for consumers who have been discharged from a correctional facility. Stabilization bed has also been helpful with helping clients or helping consumers integrate or integrate back into society. So now we're going to play a video from one of our screeners who can share a success story. I guess I can just add lib to this. Dennis had received a phone call from a businessman. He owned his own business. Eventually, he ended up losing his business, and he has 6 kids and his wife. They ended up becoming homeless, and this individual had called. So what had happened was Dennis was able to send him out of CMO, was able to link him up with CSM. Through that interim, consumer was able to get his life back, get his business back, and get his housing back. He had called back later on, thanking Dennis for the services and the coordination that he had provided. Without further ado, I would like to introduce our counterparts, which is Josh. I can't say his last name all the time. Osegueda and Elliott Plourde.
Hi, everyone. Can you hear me okay? Great. A little more. Okay. Hey, everyone. Nice to meet you all. I know it's been a long day since 7:30, so thanks for sticking in there. Hopefully the ice cream was good for you all. So my name is Joshua Osegueda. I'm the Program and Evaluation Manager for as part of Hawai'i Cares for Aloha Inadaway 211, so the substance use disorder side of things. And I'll let Elliott introduce himself.
Hi, everyone. I'm Elliott Plourde. I'm the clinical manager for the SUD program at Aloha United Way.
Awesome. Thank you very much. Next slide, please. One more. So thank you all for being here. So just to kind of give you a quick update on where we are in the Hawai'i Cares program, it's a really exciting opportunity, and it's a new opportunity for behavioral health here in Hawaii. So for over a century, Aloha Inadaway has been dedicated to serving the people of Hawaii and working on issues that face everyday people, right? So from working families who are struggling to afford basic household expenses to helping to create partnerships with county and state public agencies that improve the social health and human services for our kupuna and our low-income families. And some of you might know of our ALICE work, which is working with small and large nonprofit organizations on Oahu and our neighbor islands on health and housing and economic security and larger systemic issues that face Hawaii. You might know it as ALICE, which is asset limited, income constrained, and employed families. So those are families who are above the poverty level, yet are still struggling to survive here in Hawaii. So for those of you who might not know what 211 is, anyone can dial 211 for free. It's confidential, it's a statewide information and referral service, and helps connect the people of Hawaii to over 4,000 community resources. And it ranges from housing and shelter services to healthcare and COVID, utility assistance and food support, and so much more. And now it's with substance use. So we'll talk a little bit about that. Thank you. So I just want to show you this little graph here. So the AUW 211 partnership with Department of Health is really a new and exciting opportunity to help impact the field of behavioral health here in Hawaii by joining the Hawaii Cares ecosystem. And then if you know of 211 and AUW, since the start of COVID-19, we actually partnered with a lot of hospital systems and state and county leadership and a lot of community groups to help protect our kupuna and our most vulnerable households in the fight against COVID-19. And then just recently in 2022, this past April, we actually restructured at AUW. We hired more staff and we actually developed a new division within 211 to create the SUD Cares Referral and Treatment Program. So we work really closely with Care Hawaii, with adult mental health, with alcohol and drug abuse division to really work on integrating our systems in mental health, substance use, and behavioral health here in Hawaii. So like I said, this is a really, really good opportunity. And really this partnership with Hawaii Cares, it helps a few things. One, it helps our clients. It really helps our clients in dedicating our services to those who really need the SUD supports. And then our providers who are in the field of substance use disorder as well. So they have a really easy way of getting a hold of us. So actually, if we go to the next slide, please. Cool. So you actually saw the workflow of Hawaii Cares. So if you could just press it one more time. So Hawaii Cares is now 2 programs in one. So if you press next. So as you heard of Care Hawaii, the suicide and crisis line, 988 is there for you. And also the 808-832-3100 number is there for you 24/7. And I just want to emphasize this partnership, right? So it's suicide and crisis, it's Hawaii Cares, and it's a substance use disorder referral and treatment call center. So it's all these agencies into one for behavioral health in Hawaii, right? So anyone who needs access to crisis, mental health, or substance use, and especially if you're a new client in the system, Care Hawaii is here for you, 988 is here for you to do that triage 24 hours a day. And let's say if you have an SUD client, someone who really needs SUD services, this is where, once they're in the system, it's really easy. You could call 211. So once you are in the system, it's really simple that you could access the care you need just by dialing 211 if you're already in the system. And also just want to kind of highlight some of the partnership here, and what we do is this is a collaboration, right? It's a collaboration between adult mental health, between ADAD and Care Hawaii that makes up Hawaii Cares. So if someone dials the suicide and crisis line /988 and they are in need of substance use, the crisis center will stay on the line with the client, and then they'll begin a warm transfer to 211, seamless, right? So they don't know. And vice versa is true, because if someone calls 211 and they're in crisis or they need mental health supports, AUW 211 will stay on the line with the client. and we'll do the warm transfer with the caller and stay on with the client until someone is there to help, right? So it's not just like a dump into the system and good luck. No, like we really want to be there and be on the line and be sure on both ends, you know, the client or consumer, if they need SUD or if they need crisis, you know, we're gonna be there for them because of our collaboration and communication. Okay, next slide. So really quick, so one more please. So, you know, so once a client dials 211, if they're in the system, or, you know, let's say it's a new client and they, you know, they get hold of Hawaii Cares 988, right? So what happens once they need that SUD support and services? Well, a couple of things is going to happen. You press next, please. So every client will actually get a USIS. A USIS stands for the Universal Standardized Intake and Screening. So basically, it's a set of questions that we ask that's been highlighted through the field of behavioral health to focus on their current substance use needs, their history of SUD. We look at their mental health, we look at their health, we look if they have insurance. We ask a lot of basic questions that's going to help us provide the referral to the right agency, right? So every client who needs SUD services will get this screening. Next, please. We'll also screen for their current mental health and where they are if they do need that immediate transfer to the crisis line. So then if that's the priority, then that's what we're going to focus on. So then we could help them in that way. Next, please. We'll also check to see if they have Medicaid, MedQuest. We want to see exactly where they are in terms of insurance. And if they don't have insurance, that's okay. We'll still help them. And Elliott will actually talk about, you know, if a client doesn't have health insurance, how we'll help them. And we'll go over that in a second. And then we'll also enter their information in WITS. So if you're in the field and you're familiar with it, and if you're not, it's called the Web Infrastructure for Treatment Services. So that's kind of the portal that everyone uses in the field of behavioral health that's connected so that we can make the referral very easy. Next, please. Okay. One more time. One more time. So then, so what is going to happen for providers? So we want to make it really easy for the substance use disorder providers. So if you are in the field and you provide SUD services, you could go ahead and dial 211 and press 8. There's a dedicated spot for you for 211 so that you could easily access someone if you have a question about a client, where they are in the referral, or if you need to ask us a question, right? So we developed a line for you specifically so that you could easily access us. We'll gather your name, we'll get your contact information, your organization, and then if you press next a couple of times, there's a couple of other ways that you could get a hold of us, right? Because we know everyone is really busy in the field. You know, you could call us if that's what you need, 211 press 8 as providers, or you could email 211sud@auw.org. It's a really easy way to get a hold of us. Or we have some supervisors named Alec and Kelsey, who's really awesome. We have their emails there, so you could go ahead and email them too if you have a question about referrals. And then Elliott, he'll talk to you about benefit exceptions, and you can email him too when it comes to that. So actually, I want to hand it over next. You could, I'll hand it over to Elliott to talk about some of our services.
All right, thanks, Josh. Can you guys hear me? Okay, I can't hear myself, so I just wanted to make sure. This is the end of the day. Like, I got the worst spot. Like, I'm gonna put you at the very end of the day when everybody's tired and they want to go home. So I'm gonna try and keep it short and sweet, okay? But this is the most important part, I think, because we are a continuum of care. That's what we've been talking about for the past half an hour, is that the whole part of Hawaii Cares is to bring all these services under one umbrella so that we can best service the clients in our communities. The benefits, so I'm going to go over some of the benefits. Benefits offered by a continuum of care that provides universal entry to a comprehensive system of specialized services to meet the behavioral health needs of individuals. Some of the other benefits are increased access to substance use disorder treatment and recovery services, and serves as another option to a point of entry and referral for individuals to be connected with agencies that they may not be already familiar with. So when they call us, if we get a warm handoff from the crisis line, or if somebody calls 211 and presses 7, we have 31 or 32 ADAD, Department of Health ADAD providers in the state. But we also have information on other providers who may not be affiliated with ADAD, but it might better serve that client. So that's part of our screening process to make sure that we're referring the client to the best service in their community. Allows providers to refer other agencies to other agencies seamlessly, and helps to ensure stronger coordination of services that are custom fit to individuals needing services. Provides quicker response time, quicker referrals, and becomes a knowledge resource for individuals, families, and providers. And it helps alleviate stress on individuals looking for services, providing assistance for appropriate care. And that's the best part. Like, I've been in the field for over 25 years in various aspects of working with families, and substance use and mental health disorders is always in every part of social work that I've ever worked in. And having this access, like when I was in the field, I wish I had a phone number with 3 digits that I could call to get my client hooked up with mental health and/or substance use services. I did. I had to call each individual provider. I had to help them fill out the applications. When I was case manager, I had to drive them there and drop it off, and they go through a screening from each different provider. This is why we're here. You just come through the front door of Hawaii Cares, and we will help get that whole ball rolling. Okay, next one. So these are some of the services. These are the substance use services that are needed when helping this population and are billable through clients' insurance. Early intervention, outreach, outpatient, day treatment, intensive outpatient, continuing care, residential, clean and sober homes, opioid services, and more. So the first goal is to go through the client's insurance, like Josh was saying. If the client doesn't have insurance, then ADAD is the payer of last resort. So that's another reason why you want to come through the front door, because once the client's entered into WITS, then the providers can, submit, refer. Well, let's go to the next screen. So I always get ahead of myself. So the referrals in, this is the referrals in process. This is the whole thing that our care coordinators do throughout the day. Referrals in, so a provider, let's say a treatment program, will submit what we call the bundle. It's the ASAM, the DENS ASI, the treatment plan or health and wellness plan, cage aid, pretreatment, and other pretreatment services. So they submit that to us for authorization. And so our care coordinators go through these assessments that were completed by different providers. And if everything's kosher and completed appropriately, then we can approve it. And then that provider can be paid for these, what we call pre-treatment services. That also includes enhancement, motivational enhancement. So when the providers are contacting the client or contacting their psychiatrist or whoever they're contacting, those are all billable things that they can submit for reimbursement. Okay, next slide. The next part, I think this is the most important part of what we do, the continuum of care, because this is referrals hours. So we do follow-up treatment, follow-up calls with the treatment program. So once the client, let's say we refer the client out for a substance use assessment, that provider will do the assessment usually within a week or so, and then they'll send the assessment back to us with a recommendation. So, in the DENS, ASI, and the ASAM, they're going to make a diagnosis and a recommendation of what level of care a client needs. They submit that back to us, And then we will, if that program, let's say Care Hawaii does the assessment and the recommendation is residential, but they don't provide residential. They provide IOP and OP. So they'll send it back to us and then we'll refer the client to the appropriate residential treatment program with that assessment already completed. That's one of the referrals out process is what we do. But the coordination of the service is very important because when we're submitting these referrals out, the providers have within 5 days to what we call place and accept. And so that's part of their responsibility or kuleana is to check WITs every day, see if they received a referral, and then they're going to review it. And if they can provide that level of care for that client, they'll place and accept. And then it's kind of out of our hands at that point. And the provider is now providing the motivational enhancement until they can get the client into care. You know, sometimes like residential treatment, you know, there may be a month wait list, but the provider is to provide support to that client. Maybe they could put them in OP for a month until that bed space opens up or whatever. So that's part of the continuum of care that our care coordinators are kind of monitoring to make sure that the client doesn't fall through the cracks. Okay, and then the benefit exceptions. So that's my favorite part. Not really. But what it is when let's say a client is in a residential treatment program and maybe the provider thinks that this client needs to stay in that level of care, whatever level of care they're in, for a little longer so that they can solidify the skills that they're learning in residential or in OP or IOP. So they'll ask ADEP, so the insurance company will pay a certain amount for that, you know, 28-day residential, whatever it is. Once they exhaust that insurance, but they don't want to just let the client out if they need to be in treatment a little longer so that we can maintain their sobriety. I mean, that's the whole purpose, right? We don't want to, oh, 28 days, you're good. And then we see them next month. So we're the 28-day, after the insurance expires, the treatment provider can submit what we call benefit exception. And it's kind of the bundle. Again, it's the assessment and the ASAM and the treatment plan that justifies that client staying in that level of care. So our coordinators, and mostly me, will review that to make sure that the everything is justifiable. And there has to be, like, let's say that, you know, the client needs a little more whatever. There has to be a goal in the treatment plan or the health and wellness plan that shows that they're actually working on that goal with the client so that eventually they'll be able to get out of treatment. So that's what a benefit exception is. And that's something that ADAP authorizes and funds for the client to stay in a little longer. Next. Hi, yes. Right. Residential, yes. The Big Island, there are no residential treatment programs. There are some clean and sober living that is supported with OP and IOP. But if the client does an assessment, we might send them to, I don't know, BISAC or Care Hawaii to do an assessment. If residential is determined that's what they need, then we can take that referral and refer them to Aloha House on Maui or one of the treatment programs on Oahu. And with their insurance, you know, they help with the transportation and the coordination of getting the client from one island to another for that treatment level.
Thank you everyone here. And I think, you know, behavioral health, mental health, substance use is so important, right? So, you know, right now in 2022, we have this program, and you know, we're looking forward, and we really want to do what's best for our community, right, in 2022. So that's why we're here, is to really help the people who need behavioral health in Hawaii, which is this is not like behavioral health, mental health is nothing new. However, this partnership is new, right? So that's what we're here is to really work towards, improving not just the programs, but the system, right? And this is something that doesn't happen overnight, right? This is something that does take some time, but the resources are there, and that's what we're here to do. And then, it's kind of timely too. And, some things we can't, oh yeah, sorry, can you press next ones? So like, improvements in the system, I think this is an example of it. Because if you look at the trend where we are for SUD, we're getting more and more calls. But then not only that, if you look at the orange bar, it really shows the care coordination that goes into each client that we're actually serving, right? So it's not like we get the call and that's it. Look at the orange bar, we're actually doing more outreach. So then, a client calls us, and then we're actually not just calling them once, but we have to call them a couple times too, to be sure that they're not falling through the cracks, right? So this shows the care coordination that goes into each client, right? And that's what we're trying to do here. And then, talk about systems improvement. I mean, the average time to get a hold of someone for SUD is less than a second, right? So if someone does need that help, right, we're here for them now, in 2022, in less than a second, they could get someone on the line for SUD. And one more time, press play or whatever. So then average time, and this is not just a quick phone call, we're on them on average, and at least in the past 5 months since we got this contract, for 13 minutes, right? So we're on the phone with them, and we're really listening to them, and we're trying our best to help them, right? So, talk about system improvements, I think this is a step in the right direction. And then I'll give you a testimonial to go with that. So here's one example. And this is just in the past 5 months, 5 months into this program. So a Kapuna client with pre-existing health conditions called AUW for residential treatment for meth. The client told the care coordinator, "I don't want to die like this. Can you help me like you helped my ex-wife?" The client proceeded to say that his ex-wife called 211 and was able to access care and get back on her feet. The client said, "Oh man, you guys really helped her. She looks great. She looks healthy, and she has more weight on her now, and she looks alive." So the client, saw clear results from his ex-wife's experience, and it motivated the client to seek access to care for his own SUD issues. And then the care coordinator was able to get the client referred to treatment, right? So that shows like, we're there and we're doing something to help that client, right? To get that client where he or she needs. Elliott has one story, and then we'll take questions and answers actually from everyone here.
Okay, last one. One of the other testimonials that one of our care coordinators received, a young man called who lives on a neighbor island seeking SUD services. The client was referred for more thorough assessment at a residential program on Oahu. Unfortunately, the client relapsed and missed his flight to Oahu. The client called back the SUD program and said, "Man, I messed up. Tell the first AUW coordinator not to be mad at me." The AUW coordinator who received that call assured the client that our staff would not get upset with him and emphasized that. The client stated he was not even considering treatment until he spoke with the first AUW care coordinator. Client repeatedly thanked the AUW staff, and the coordinator number 2 picked up where the coordinator number 1 had left off. Client was referred into a LCRS to begin treatment and recovery. And I just wanted to add one more, because yesterday, just to show you how all this works, yesterday I got an email from ADAD. A woman on Kauai had emailed the ADAD, online website. And she gave her whole story of how she was struggling, that she had received mental health and substance use services in the past, but I guess she started using again and was struggling for the past couple of years. And she reached out to ADAD through the website and said that this is her last attempt at getting her life together. And so ADAD forwarded me the email and said, "Could you please follow up with this woman?" So I called her up yesterday, and spoke to her briefly because I wanted to get her the services she needed. So we were able to connect her with the crisis line, who then hooked her up with an assessment today. Actually, she met with the psychologist on Kauai today to get her assessment. And then she emailed me back she emailed me back and said, thank you, that this was very helpful to her. And I just wished her well. And, you know, that's part of the continuum of care, that we're all working together to provide the best services we can for the clients that we serve.
And there you have our AUW 2-on-1 team for the SUD portion. So I would like to apologize for that little interruption, if you will, but that's okay. That's crisis. That's how we roll. At this time, I would really ask if you guys could just give a hand to our presenters today for Hawaii Cares. And then I'd open it up to any questions that you folks might have. I know there's some online as well that we'll try. I believe everyone was able to address some of that. If anyone has a question, please feel free. Yes, ma'am. Sure. Nicole. HSH. Mhm.
Yeah, they're very good clients, but one thing though, with some of my clients who are not, who don't have substance use disorder, when they call the crisis line, they can't, and they could even get in with this time, so if they have an alternative number to call it 8323100 for the 98. Because we experienced it, because I was telling her that they're supposed to answer right away, because there should be one responder, right? Or one to take the phone call. But she tried when she was with me in my office, and we couldn't get it.
Does you want to answer that? So there isn't, so the first response to the first part of that question is there isn't an alternative number, and there is not an alternative number. And we've working really hard. Our providers here are working really hard. As you have seen in the slide, it takes them, what is our average speed of answer? I think it's about 13 seconds, 13, 14 seconds. So it is a work in progress. So I would like to encourage you and your client to continue to call back. Don't try just once, keep trying. If there is no response, like maybe you get voicemail, please leave the information, please leave their name, please leave the telephone number or the text and chat. Thank you. He's doing this thing that we have text and chat now. So if the phone call doesn't go through, text, chat, jump on that way. There's dedicated people who are responding to that medium, right? So I would just encourage to do that. And please let me know. I will, my information is on the presentation as well. If you receive any issues and concerns around responsiveness or lack of responsiveness, please let me know. And I will work with our partners here. But Sherrie, did you want to address that?
No, the same thing. We're trying our hardest to answer every call as quickly as possible. We have, thank you. So we're trying our hardest to make sure that we're answering every call as quick as possible. We have a data tracking system in which we're able to see when all of our crisis counselors are on the call. So that helps me to know. So sometimes, like if there's any times in which you don't get a response, like Belinda said, I know that it could just be frustrating, but call again, because it could be as quick as a second that they're wrapping up a call and they're going to be available again. So we're able to see. So the crisis counselors are trying their best to make sure that they're able to answer every call as quickly as possible. And like Belinda said, go ahead and leave a voicemail, because the team leads are responsible to check the voicemail promptly and to either call back themselves or to assign one of the crisis counselors to do the call.
So that's the reason why she needed that form. So she had been gotten.
Oh, yes. No, we have 988 now. So yeah, please encourage.
And then she's gonna get you guys.
Mhm.
Call 911
Oh.
and 911. That was just something frustration with two of my clients. That's what it is.
Thank you for that.
And she doesn't have someone that's able to do that chat or that.
So work in progress, process improvement. We will continue to work on that. Thank you. Yes.
Two questions. First one is really easy. Just curious, how many beds are available on OCRS things?
For which island?
Well, Oahu for me, but I guess in general.
So Oahu has 16 beds, Maui has 8, Hawaii Island has 8.
And then the second question is about availability for detox services. So I'm a family doc that does other things. I've had issues trying to find a place for patients with alcohol use disorder that I'm suspicious are going to have severe alcohol withdrawal. They get kicked out from the ER because they're not in it. How maybe other people in this room know as well. What have people done for that when you're really suspicious they're going to have a really bad withdrawal? You can't get them in where you want.
Yeah, thanks for bringing that up. It's actually a conversation we're having really like continuous with ADAD, Alcohol Drug Use Division. We do at ABW and or 98, 211, right? If someone needs that detox, we do screen first. And if you want to speak to the services.
Yeah, I mean, if they're getting kicked out of the ER, is that what you were saying?
Yeah, so these are folks that are still drinking, so they're not in severe withdrawal yet, but are likely to go into severe withdrawal, but possibly.
Right, I mean, there is a detox on Oahu. Are we talking about Oahu? Or-
Yeah, it's tough to get there.
Oh,
It's like, okay, yeah, 2 weeks from now on Tuesday, if they want to go into withdrawal, then they're good. So it's kind of hard to time when somebody's gonna.
yeah, maybe that's when you should call us. Because we could do a warm handoff to the detox, Salvation Army detox. And
Is that the only spot? That's my real question. Is that the only place?
If I can comment, one of the things with alcohol is that ATS detox is requiring detoxing, an alcohol evaluation from the doctors. So if you're able to get that for the consumer before they leave the emergency room, that will help with the collaboration and referral process to the detox center. So if you can get that, because they're gonna need medication in order to detox, and that's one of the requirements for ATS detox, if you can coordinate that on your end.
Yeah, so I have done that several times from an outpatient setting, I'm not in the ER, outpatient. But it still is tough, even with the medication plan, with the meds in hand, patient is ready, oh, but not yet. They can come back next Wednesday. So I mean, it's a lack of that.
Well, my suggestion with that, if they're also having a mental health crisis with the alcohol detox, give us a call, give crisis line a call. Maybe we can send out a crisis worker to help evaluate and stabilize the consumer and provide them additional support while they're going through their crises.
Yeah, sorry, just to follow up last time, is Salvation Army the only health facility?
It sounds like that's
Okay.
exactly
That was
it.
my-
But also remembering what Josh had mentioned, that is a conversation that's continuing with ADAD. So hopefully we'll have some good news or better news soon. Thank you.
Just a few quick questions from the Zoom. Some people are asking whether callers need to tell you when they're where they are to dispatch 911 to them.
Do they need to,
What was the question?
does the caller need to share their location when you're going to dispatch 911?
It would be preferable that they do something that way the police officers are not running around trying to locate a person. We want to provide an address so that we can get them help ASAP.
Some of, just to add to that, when they're calling, 988 or Hawaii Cares, the intervention that the crisis counselors are trying to do is always collaborative, right? They're trying to engage the person. They're trying to ask them if they, because of what's happening, because they're not able to keep safe, we need to send somebody out there because it's all about saving your life. Oftentimes in those cases, you might have some folks who don't want that, right? Because they're still kind of ambivalent on whether they want to live or not. So it is kind of a tricky thing. The crisis counselors do a really good job of trying to engage the person, trying to tease out where they might be if they're not willing to give that up. We would love if they do, because it does make the job a lot easier. But we do understand that oftentimes when people are in that state of mind where death is knocking at the door and that's all they're staring at, that's not going to come that easy. But we have skilled counselors and they do a really good job at trying to figure all that out. But just know that if you have family members or clients or consumers who you're dealing with, just let them know that that's the reality. When they call Hawai'i Cares, it's all about saving their lives and trying to get them the help that they need. So that is the framework that they're working off of. And oftentimes it's going to be a situation where they're not going to feel like, that's what they wanted, but it's probably what they needed, right? So if you can kind of help them understand that, when they come out on the other side, oftentimes they'll be like, okay, I get it. But at that moment, it's probably not going to be what they want to hear. But, yeah.
Yeah, another question from the Zoom. Is it still Care Hawaii for adults on Hawaii?
Correct.
Correct. Okay, and how long is the wait for clients needing substance use treatments, inpatient or outpatient?
Well, I'll start. It varies. It definitely varies based on the island and also what type of program. I don't know if they have a specific number of average days, but I would want to.
Yeah, I mean, that's a hard question.
Yeah.
It depends on which treatment that they're needing, what level of care they need, which program they're trying to get into. That's another reason why to call us, so we can help coordinate that service. But I can't give you a specific date or a timeline.
We also recognize the need, right? So like there's more services that needs to be available. There's more beds that needs to be available. And these are conversations that we are having with ADAD. So we recognize that. And I know it's something that is really being considered by ADAD leadership in terms of how we get more beds available.
And I think just to add to that one of the challenges I think we're all facing if you're working not only in behavioral health, but just working out in the community in different facets. It's one thing to have money for beds. It's a whole other thing to find the people who are going to do the work. And that kind of seems to be our challenge right now. So just kind of putting that out there for everyone to kind of understand the barriers.
Sorry, one last quick question from Zoom. Is Dennis back with Hawai'i Cares?
Yes, Dennis is back.
Yes.
Thank you. That's all my quick questions.
Any other questions or comments? Yes.
This is for the SUD services. Are intervention services provided? Or are there referrals to interventionists to assist families?
Could you repeat that question?
Are there intervention service providers that are that families can access to get an intervention service for their loved ones who are addicted? Are there providers that you folks work with to connect them with intervention?
Right.
Interventions.
I mean, we can refer the client for an assessment. I mean, there are individual providers in the communities that provide, we don't actually work with any.
Do you have a network you can refer these families to get interventions to assist with getting their loved ones into treatment?
Right. That's a great question.
Can I respond in regards to interventions? I'm a provider in the community. And so what we've seen as providers, doing interventions is ruthless. If the person doesn't want to quit, no amount of family input. If you watch the show Intervention, I don't even know if they're doing it anymore, like 9 times out of 10 at the end, it says 3 months later, so-and-so relapsed and either passed away or they're in their full-blown addiction. So like I've even done interventions with my own family members and it's really not effective. So you can put them in touch with a provider and try to get them harm reduction, try to get them like to process through the stage of change to get to a place where they actually comply. Then you can do something. But don't go with that do an intervention, I refer them to Al-Anon, because otherwise you're just banging your head against the wall.
And the reason why I bring it up is the family might present, say, you want an intervention to your loved one into treatment, but then that's where the provider can direct them into family therapy.
Yep.
Rather than that, so then the presented nominal is the family wants an intervention,
Yeah.
right? So that's where professionals like you will look at other alternatives instead of our core intervention. So,
Yes.
but that's how it's being presented to this Hawai'i therapy.
Yeah, and so thank you for that and for the question. And just to kind of, and feel free to chime in after this, but so, you know, if it's an adult client who needs help, you know, we actually encourage, so let's say, for example, we get this on occasion where a mom is calling on behalf of an adult son or daughter, right? So we right, and the mom is like, you know, my son is on that and needs, you know, this, and this, right? You know, unfortunately, you know, because they're an adult, I mean, we can't just take that referral ourselves. Like, we encourage the family member to please have that adult son or daughter call us, right? And again, because kind of like you said, right, like, if like truly, like, there's only so much we can do, and we're just on the front line, let alone if you are a counselor, right? If you are a psychologist or whatever, a CSAT, right? I mean, you're not a magic worker, fortunately, right? You just can't sprinkle the dust and then hopefully they're fine. There has to be that motivation, truly, right? Like, to change. But so we would, if that, in that example, right? Like, we would encourage the family member to call us to have the adult, right, son or daughter call us, so then we can get them the help they need. But that's just what we've encountered. Yeah, anything to add?
Yeah, I mean, oftentimes we do interventions over the phone. A mother or a mother of an adult child will be calling and screaming and saying, my son is here or my daughter is here. And I want to get them treatment, and the client or their adult child is in the background yelling, I don't want to go to treatment, or I'm not going to stop using. I mean, we've done interventions right on the phone. But I have spoken to people. I'll just give you one example. I can clearly remember the conversation with a mother on Maui a few months ago, who had called, and she was very upset about her son, and he'd been in treatment after treatment after treatment, and he kept using, and he kept, and I had a serious conversation with her. Her son was 28 years old. He's living upstairs, and he's using, and he's stealing from them, and stealing all this stuff. And I just talked to her about healthy boundaries, and I talked to her about enabling the behavior that is continuing on in her home. So anyway, she was able to get the son on the phone. I got him to go do an assessment. 3 weeks later, I didn't know what happened to him, but she called me crying. She was so happy because her son was at Staten Island Treatment Center on Oahu. And she said, thank you so much for telling me the truth, because a lot of times the people, you know, it's their child, right? They don't want to hurt them, and they don't realize that they are hurting them by enabling them. So that's part of the conversations that we have with families.
We also know that in a household of substance abuse, that the family members are also affected and they need assistance as well. So this is a perfect opportunity, another case scenario where the parents, they can give crisis line or our centers a call, and we can provide them the support that they need to help go through watching a loved one go through substance abuse. So support, this is the whole case scenario where Hawai'i cares come into play, whether it's the mental health crisis, whether it's the behavioral health, and also with the substance abuse. This is the culmination of services that can be provided to support the whole family.
I think that's kind of a lovely way to end. I think we're 4 minutes after 5. I think our time has come to an end. We just really thank you guys for hanging in with us. The last group of the day, give yourselves a hand. Thank you very much. We'll send out the presentation. I think it'll be posted, and feel free to reach out to any one of us for any questions or comments or concerns. Thank you, everyone. Have a wonderful rest of your weekend.